There's a lot of talk in Washington about budget deficits, debt. Our message is a simple one. Keep your hands off Social Security, Medicare, and Medicaid. Look, there are good reasons to be concerned about the federal deficits, but it's wrong to put the blame on what some people call entitlements, which is really code for Social Security, Medicare, and Medicaid. Like it's their fault America's in a financial mess? No. What's the U.S. running budget deficits? 3 reasons. First, the massive tax cuts under President Bush. Second, 2 wars fought on borrowed money. And third, the worst financial crisis and recession since the Great Depression. Social Security has absolutely nothing to do because Social Security pays for itself through the payroll tax. It's not even part of the federal budget. The chart shows us that the cost of Social Security, the red line, is well within the amount of money generated in the Social Security system. That's going to keep going, maybe not forever, but under the current system at least 2033, and with one simple change, it would be in perfect shape until 2085. The change that we're looking at is this. Right now, the Social Security tax ends when income hits $110,000. If we just lift the cap and tax everybody at the same rate, regardless of income, that's all it would take to make Social Security totally healthy, at least until the end of the century. Now, what about Medicare and Medicaid? They don't pay for themselves. They do come out of the federal budget, and the costs definitely are going up. But the main issue here isn't the cost of Medicare and Medicaid. It's the entire health system, government and private. Actually, Medicare and Medicaid are part of the solution because their costs are growing slower than those in the private sector. If we look at the recent history we see from 2000 to 2005, the growth in spending per enrollee was much higher in the private sector than in either Medicare or Medicaid. The same pattern continued for the next 5-year period. Private costs went up the fastest, and that's expected to be true for the coming decade. We've got good strategies in place to hold down the cost of health care. New rules for hospitals to make sure they're not overcharging. Similarly, for insurance companies to make sure that they actually put their money into health care. And there are new ways of controlling the cost of drugs. All of these are part of the Affordable Care Act, Obamacare. Let's give that time to work before we start messing with essential services. So the summary is simple. Social Security isn't part of the problem, and Medicare and Medicaid are actually part of the solution. Keep your hands off Social Security, Medicare, and Medicaid.